One common cause of back pain that we see here at our clinic, TruMotion Therapy, is back pain due to an injury at the disc. Okay, you may have heard the term bulging disc, herniated disc. We're just going to refer to them as disc injuries today. We're not going to get too far into the nitty-gritty. Oftentimes when people hear that term, okay, disc, they freak out because they envision a herniated disc that could be pressing on a nerve. I just want to reassure you that there are various levels of disc injuries ranging from mild to severe. Most cases fall on that mild end of the spectrum. So today we're going to be talking about those disc injuries. We're going to bring some clarity to this maybe complicated or scary issue. We're going to be answering a few questions along the way. We're going to talk about what the intervertebral disc is, what are the symptoms of a disc injury, what types of disc injuries are there, how they happen, how does a disc injury occur, do you need imaging, X-ray, MRI, or anything like that, and then what does treatment look like for a disc injury? So, to start, we're going to define what the intervertebral disc actually is. So, here's a segment of your spine. You'll see here we have a bone, we call this a vertebrae. You have another vertebrae below it, and right in between that vertebrae is the intervertebral disc. It's a soft tissue that allows for good freedom of movement in the spine. That's why your spine can move pretty well in different directions. You have discs in your neck, your upper back, and in your lower back. Today we're going to be talking specifically about the ones in the lower back. Now, unfortunately, just like just about every tissue in the body, discs have the potential to become injured, but fortunately, they also have the potential to heal. So that's the silver lining that I want you to take away from today, is that we can have these disc injuries, but given the proper treatment and the proper environment, they are able to heal. What are the common symptoms of a disc injury? This will range from person to person, but typically with the lower back, we'll see stiffness or pain first thing in the morning. As you get up and move around, it starts to feel better. We'll also have stiffness or pain with prolonged sitting or after prolonged sitting. It might be tight or painful once you get up, but as you start to move, it feels better. There can be pain with coughing or sneezing, bearing down to take a bowel movement. These activities, coughing, it creates pressure within your torso, creates pressure within your intervertebral disc. It can make those issues kind of angry. We can also sometimes see pain not just in the lower back where the disc is, but radiating pain down the leg as well. In some cases, we may not even actually have pain in the back, we'll just have pain along the course of the nerve down the leg. So those are some of the common symptoms of an intervertebral disc injury. Now, what type of disc injuries are there? So disc injuries can range from where the injury actually occurs on the disc, and they can range in terms of severity as well. Like I said, we're not going to get too much into the details between a disc bulge, a herniation, a sequestration, anything like that, but just keep in mind that there is a range of severities of disc injuries, from a mild backache to severe pain that leads to pain radiating down the back of the leg. Now, the tricky thing is that the level of pain that we're experiencing does not directly correlate with the severity of the injury. So I'll say that again. The amount of pain that we experience does not correlate very well with how severe the injury is. I've seen people who come in severe pain, and given the right conditions, the right treatment, they're actually feeling quite a bit better in about 48 hours. So we can have this severe pain, but it might not be that serious. And fortunately, about 98% of people with disc injuries will actually not require any kind of drugs or surgery or anything like that. They can be managed conservatively. So that's a really positive thing to keep in mind. So how do disc injuries actually happen? Now, just like any tissue in the body, if they're overstressed, an injury can happen, right? You put more stress on the tissue than that tissue can handle, and it will start to hurt typically. That can be due to repetitive motions or a strenuous motion. Now, the disc is a little different than, say, your knee or your ankle, in that it is around a very sensitive structure. Your spine, your spinal cord, right? Your central nervous system. This whole area is a very sensitive area, and the body wants to protect it, and it has a very robust way of protecting this area as well. So if there is even a threat of injury to a disc, the body can create a pain response. It can tighten up the muscles around it. So typically, your body will create that pain response before there is actually injury that occurs. So do you need an X-ray or MRI if you suspect that you have a disc injury? Now, this is a fair question. You want to see what's going on in the back. Could there be anything going on that is worth note? Now, one of the main types of imaging that we see in musculoskeletal medicine, kind of that go-to form of imaging, is X-ray. X-rays are really good at showing the integrity of the bones. They can show the health of the joint space as well. But like I said, X-ray will show, okay, is there any fracture in the bone? Could there be an infection? How's the joint space looking? If the joint space is narrowed, it can indicate some arthritis, but it's not going to show you if you have a disc bulge or herniation or anything like that. It's not going to show if the disc is pressing on a nerve root. That's where an MRI comes in. So an MRI will show that. It will show if there's a disc bulge. It'll show if there's any kind of pressure on the nerves on the side of the spine. But the thing we need to keep in mind is that it is not uncommon to have an asymptomatic disc bulge. About 30% of people in their 30s may have a disc bulge that is asymptomatic. So if you go in for imaging and you have an asymptomatic disc bulge, it could just be an incidental finding, and it could lead to unnecessary treatments. Getting that imaging leads to higher medical costs. So the guidelines say that in the absence of any red flags in the history, it's not a good thing to start with imaging. Again, it leads to overall higher medical costs and possibly some unnecessary treatments. So what is treatment like for these disc injuries? Now, like I said before, fortunately, upwards of 90% of people with back pain will not require any drugs or surgery to manage their back pain. They can be managed conservatively, which is very good news. So typically, when people come in here, they're always going to get a great history and evaluation, and we're going to figure out what is truly causing this back pain. Could it be caused by a disc injury? With disc injuries, we'll typically see a movement of the spine that the spine doesn't like. So we're going to teach people how to temporarily avoid that movement. And on the flip side, there will be a movement that the spine does like and can be very therapeutic. Additionally, if there's any muscle tightness, we're going to work on getting those muscles loosened up. If there's joint tightness, we're going to do the same with the joints. And then we're going to teach proper movement habits and proper movement patterns, so we're not stressing the back more than we should. We want to work on strengthening the core and the hips so we can build that robustness around movement. We can create movement confidence. Okay, we don't want to be overstressing areas that shouldn't be overstressed, but we also want to preach the importance of movement. So what we're going to go over right now are some ways that we can, what I say, spare the spine or move with intention. These movements are important in those early phases of a back injury, so we don't overdo it. Common things that we want to work on are sitting and standing properly. Okay, might sound silly, right? How do you sit and stand wrong? But typically people with back pain do it in a way that overstresses the back. If you're sitting and standing 50 times a day, you don't want to be picking the scab 50 times a day. You want to make sure you're doing so with intention, moving with intention. So the way people typically go from sitting to standing, standing to sitting when they have back pain is by putting their hands on their thighs. They're trying to brace and take the pressure off of their spine and go and stand up like that. Now, unfortunately, that actually puts more pressure on your spine, so we want to avoid doing that. What you want to do is sit up nice and tall, get your feet under you, nice proud chest, and simply push your feet through the floor, keeping that spine nice and straight. Then when you go to sit, same thing, push the hips back and come back down, okay? We are moving from the hips, we're not moving from the spine. We want to be thinking about the same thing when we're going to pick things up off of the floor as well. Now, getting into that squat position every time you need to pick up your keys off the floor might seem a little unrealistic. So the way that I typically tell people to do it is get into a lunge, and bend down and pick things up. That keeps your spine in a nice upright position so you're not putting too much stress on those joints. Now, if you do have to sit for a prolonged period of time, you want to make sure that you're using something under your back. You can roll up a towel, roll up a sweatshirt, put it right at the base of your spine, right over your belt. That helps keep the normal curvature of the spine so you're not compressing your spine when you're sitting for too long. So I hope that provided some clarity to maybe this kind of scary or confusing topic. If you are concerned that you have some back pain or a potential injury to a disc, we'd be happy to help. Please visit us at TruMotionTherapy.com to learn more, to reach out if you have any questions, or to schedule an appointment. We look forward to seeing you.